everybody. Welcome to our webinar today. If you have not been here before, my name is Laurel Glenn, and I'm the project manager for safety. We appreciate you joining the webinar today on using injury rates and health behavior theory to increase sustainable transportation. If you've noticed, you've all come into this webinar muted, as well as having your video off. That does not have to remain that way during the question and answer session, but until then, we will have you muted and videos off. There is a question and answer section at the bottom of your little Zoom screen. There's a little icon there. You can always hit that and send a question if you think about it during the presentation, and we can address those during the question and answer session. You can also send links if you want us, to share any kind of other research or any other resources. Feel free to use that question and answer section for that as well. Or you can also send a chat message to any of the panelists as well in the bottom section of your Zoom window. During the question and answer session, you can ask to have your microphone and video unmuted, and we can bring you on to ask your question, or you can type it out, whichever one you feel most comfortable with. At this time, I'd like to introduce the presenters. Dr. Nishita Sinha is a behavioral economist and an assistant research scientist at Texas Transportation Institute's Center for Transportation Safety. At TTI, Nishita's research focuses on using experimental and quasi-experimental methods to analyze policy questions of occupational and traffic safety. Her recent projects have weighed on the role of socio-demographic factors in aviation safety, racial overrepresentation in traffic crash data, and estimation of injury risk to pedestrians and pedocyclists, which is what we're going over today. She works with large health data sets to gain a deeper understanding of the linkages between traffic crashes and health outcomes. Also from TTI, we have Eva Ship. She's going to be here during the question and answer session as well. She is an injury epidemiologist and faculty member at Texas A&M School of Public Health. Then we also have three Virginia Tech public health researchers here. We have Samantha Edwards, who's a second-year master's student of public health, studying community health promotion and equity and infectious diseases, and serves as a graduate research assistant for the Virginia Tech Center for Public Health Practice and Research. Domenique is a project associate at the Center for Public Health Practice and Research at Virginia Tech. She received her master's of public health from Virginia Tech and her Bachelor of Science in Nursing from Villanova University. She's also a certified health education specialist. Also from Virginia Tech, we have Dr. Kristina Jiles, who's also available during the question and answer section. Dr. Jiles is a research assistant professor in the Department of Population Health Sciences with the Center for Public Health Practice and Research. She's also a public health specialist for the Virginia Cooperative Extension. I'm going to go ahead and turn the presentation over to Nishita, and you'll see we have a lot to share with you today. Thank you very much. Nishita?
Thank you, Laurel. Thank you, everyone. Good afternoon, and thank you for joining us here. In today's presentation, I will discuss a method we developed and followed at the Texas A&M Transportation Institute to estimate pedestrian and cyclist injury rates, and why it is important to move beyond the traditional measures of injury rates to gain a deeper understanding of the risk facing commuters. Using alternative transportation such as walking, bicycling, scootering is often touted as effective ways to boost physical and mental health while reducing greenhouse gas emissions. However, walking and cycling must be promoted, factoring into the associated injury rates. Information about injury rates help inform interventions to safely engage pedestrians and cyclists. Traditionally, injury counts are divided by total population or population by gender and age to arrive at per capita injury rates. Or in some cases, raw counts, as presented in the chart here, are used to understand the risk facing pedestrians and cyclists. The chart shows rising fatality counts over the years, however, not accounting for activity-based exposure like distance and duration commuted can lead to misleading inferences. For example, certain areas may experience a drop in counts because of reduced travel, but not because there is an actual decline in the injury risk. Injury rate is one of the metrics used to quantify injury risk to different commuters. There are two components to measuring injury rates, the numerator or injury count and the denominator or a measure of exposure. For numerator or injury counts, fatality analysis reporting system, or FARS as we know it, is a nationwide census of fatal injuries in motor vehicle traffic crashes. That leaves out non-fatal injuries occurring in motor vehicle traffic crashes and other crashes that occur without involvement of a motor vehicle. Safety professionals also rely on state crash database, which in the case of Texas is the crash records information system. While this includes crashes of all severities, it only includes crashes that involve motor vehicle. In some cases, researchers utilize specialized data sets created using especially designed surveys, and while they may include all severities and injuries, these data may not be easily accessible or provide historical data for measuring trends and perform advanced analysis. Finally, public health injury surveillance systems such as hospital and trauma registry records have gained popularity for their ability to supplement crash database with additional information on injury diagnosis and description, length of hospital stay, and richer demographic data to support road safety efforts. Talking about denominators, population has traditionally been used to estimate injury burden. Population is an easily available information as compared to activity-based exposure measures such as trip count, distance traveled, and travel duration. Exposure is traditionally defined as number of crash opportunities. The FHWA website has a really good discussion on exposure that I would urge all of you to check out. It explains that there are several opportunities for a pedestrian or a bicyclist to get exposed, like when they cross a street. But what about when they cross the street in absence of a motor vehicle? Likewise, are bicyclists more exposed when traveling in a bike lane that is adjacent to a motor vehicle lane than one that is not? Now, of course, it is not feasible to gather data on ped bike movements all the time. Hence, the exposure measures that we utilize in our study is based on data that are available from travel surveys other than population and follow a more operational definition of exposure. Trip counts is one such measure, but not all trips are same. Some are longer and take more time due to heavy traffic. Additionally, walking trip segments for multimodal trips are often not included in trip counts. Travel duration does better by accounting for variation in speed of walking and biking, and the literature suggests that people are more likely to remember trip duration than trip distance. Trip distance also does better than trip count by factoring in the increased exposure in longer trips to traffic dangers than shorter ones in a similar traffic environment. The objective of our research, therefore, was threefold. We firstly examined numerator data sources and identified their strengths and weaknesses. We also estimated 3 different exposure measures and finally combined the numerator and denominator to compute injury rates using all numerator and denominator data combinations. For the numerator, we reached out to the Texas Department of State Health Services for EMS and trauma registry data. We were able to get data from 2018 through 2020. The EMS data set is defined to include all calls for assistance, medical or trauma. The recommendation is that EMS providers submit data monthly that are shared electronically. Trauma registry, on the other hand, is a collection of hospital data on select traumas and admissions. EMS, trauma registry, and crash database each have their strengths and limitations. Hospital data may miss injuries that were minor and for which no medical care was sought. Additionally, these data do not include information on crash factors. Conversely, crash reports typically have broad injury classifications and can lack information about injuries that are only able to be diagnosed in clinical settings. EMS data includes information on immediate patient condition, response time, and emergency treatment, all of which can be really useful in informing safety interventions. In our case, EMS database missed injuries that were brought into the hospital via private vehicles or non-EMS vehicles. Likewise, a trauma registry does not include injuries that were less severe to qualify. Data are submitted within 3 months of the date of discharge for trauma registry. Additionally, these data, the hospital data may have multiple entries if patients were transferred between multiple hospitals or EMSs. We wanted to document for Texas how the injury count varied between the different data sources and the utility of each data source in supplementing each other. Here we are showing the variables we requested from the health department, primarily demographic, as you can see, and injury diagnostic codes to be able to identify pedestrian and cyclist injuries. In this slide, we present the ICD-10 codes we use to identify pedestrian and cyclist injuries. So V00 to V09 were identified as pedestrian injuries, and V10 to V19 as pedal cyclist injuries. So ultimately, by counting the rows identified as involving either of the two commuters, we arrived at injury counts for both groups. The denominator data, or the exposure measures, were initially estimated by Texas A&M Transportation Institute for FHWA project using National Household Travel Survey that was conducted in 2017 and census data. And a tool was created that has exposure estimates combined with fatality counts for pedestrians and cyclists for all states and metropolitan planning organizations in the US. In this study, using the established methodology, we extrapolated the measures from 2018 through 2021, except 2020, for which the required census data were not available. We assumed a constant person trip rate through the years and used annual total population and commuter population by mode to estimate exposure for years beyond the travel survey year, which was 2017 in our case. I will now discuss a few results from our study. The injury count from different data sources are shown here. The state crash database has the highest count, followed by trauma registry and EMS. Now, I would like to remind here that the crash database, or CRIS, does not include events that involve non-motor vehicle. And while trauma registry does include both motor and non-motor vehicle events, the cases have to fulfill the trauma registry inclusion criteria. In 2020 and 2021, the CRIS entries are lower, as you can see, perhaps due to COVID restrictions and that many people were not on the roads as much during the better part of 2021. Data comparison for pedal cyclists exhibit broadly the same pattern, with CRIS reporting the highest count, followed by trauma registry and EMS, except in 2020, where trauma registry counts exceed CRIS counts. We hypothesized that the decreased motor vehicle travel but increase in pedestrian bike exposure resulted in the narrowing gap between CRIS and trauma registry count. We continue to investigate the data from different aspects, such as this, for a manuscript that is underway. In this chart, we show the exposure of pedestrians measured by number of trips, miles traveled, and hours of travel. All three measures have shown a slow rising trend, except in 2019, where we see an uptick and then a decline in 2021. Unfortunately, we do not have the 2020 numbers, excuse me, the 2020 measures, because the Census Bureau has not released 2020 estimates that are required to estimate the measures. For pedal cyclists, we show the exposure of pedal cyclists depicted by the same three measures in this chart: trip counts, distance traveled, and trip duration. Pedal cycle exposure has been largely stable during the study period, which is 2013 to 2021, except for 2020 data. In this chart, we show the injury rates for pedestrians, and that the injury rate follows the numerator and denominator size. The fact that trip counts and distance traveled are fairly close to each other for pedestrians that yield similar rates. Smaller trip duration results in higher injury rates. Now, contrary to pedestrian exposure, for pedal cyclists, miles traveled is the highest, followed by trip counts and then hours of travel. Consequently, we see the injury rate highest when using travel hours as denominator, followed by trip counts and then trip duration. Finally, I want to share a snapshot of the exposure tool that is publicly available if you would like to look at ped bike trip counts and distance duration of travel for any state in the US or an MPO. That is all I have. And next we have Samantha, who will go over the formative evaluation conducted by VTTI to understand attitudes, perceptions, and beliefs associated with alternative transportation choices among the Virginia Tech community. Sam, you can start when ready. Thank you, everyone.
Hi, everyone. Thank you so much for introducing me, Nishita. So as she said, we're going to be talking about the formative evaluation that went towards understanding the attitudes, perceptions, and beliefs of alternative transportation within the Virginia Tech community. To give a little bit of background information, alternative transportation is comprised of using any method of transportation that does not include driving alone. Methods of alternative transportation can include walking, biking, busing, riding a scooter or a skateboard, and carpooling. So alternative transportation can be a solution to transportation gaps, and it can encourage better environmental and behavioral health choices. The purpose of this project was to explore the attitudes, perceptions, and beliefs involved in decisions regarding the use of alternative transportation by faculty, staff, and students. We conducted focus groups and interviews with faculty, staff, and students to address issues related to transportation on and around Virginia Tech's campus. The focus groups and interviews addressed descriptions of various modes of transportation, the use of safety of alternative transportation options, and barriers and facilitators to the use of alternative transportation modes. A thematic qualitative analysis using Braun and Clark's multi-directional 6-phase guide was conducted to identify, analyze, and report major themes and sub-themes using an inductive approach. So our results are going to be presented in the form of a thematic map, which just shows our primary data points and how they connect. As seen here, we have 3 primary themes: alternative transportation mode accessibility and utilization, alternative transportation challenges, and alternative transportation safety and precautions. And I'll be going through each of these individually. Starting with alternative transportation mode accessibility and utilization. Most of the faculty and staff participants thought that the infrastructure in Blacksburg best supported bicycling, while most of the student participants thought that it best supported busing. The top mode choice, or the primary mode of transportation used for the longest or most frequent trips, for faculty staff members was biking, and if they could not bike, their backup mode choices were walking and then taking the bus. On the other hand, the top mode choice for students was taking the bus, and their backup modes were equally either biking or walking. Participants indicated that it was important to have backup transportation options. Faculty and staff members specifically indicated that having multiple options was important to them, while students specified that it was important that any backup options be alternative modes of transportation. Next, we have alternative transportation challenges. The overall top challenges for faculty, staff, and student participants that they face when choosing between driving and alternative transportation mode, such as busing, biking, or walking, were time, inconvenience, and weather. And these codes are starred here on the map so that you can see where they fall within each of the themes. The first one that we're going to talk about is busing challenges. Participants indicated that the main challenges faced when taking the bus were inconvenience and proximity to a bus stop. Faculty, staff, and student participants felt inconvenienced by using the bus as an alternative mode of transportation because other transportation modes like driving a car would be more feasible and accessible. Proximity to bus stops was also indicated as a concern since participants mentioned bus stops being too far away from their residence. Faculty staff expressed that they have responsibilities such as taking their children to daycare or school, going to the grocery store, and running personal errands, which makes it less likely to use the bus as their primary mode of transportation, but rather taking a bike or driving a car would make it more convenient. Additionally, their lack of accessibility of taking a bus due to proximity to bus stops was deemed as a challenge. Students mentioned bus challenges as it related to bus crowding due to common class or activity timing, and would rather use another mode of transportation. Other significant public transportation challenges brought up by students were Blacksburg Transit's or Blacksburg's local bus system, lack of accessibility on weekends and during summers, and that there are negative perceptions of bus stop locations and bus routes due to certain bus routes not getting them to their target location on and off campus. Moving over to biking challenges. As we saw in the alternative transportation mode accessibility and utilization section, Biking was the top mode for faculty staff, and it was the backup mode for students. The overall top challenges for bike meeting expressed by the majority of participants were weather and drivers and traffic. Specifically, faculty and staff participants indicated that their main challenge was visibility at night. This was expressed as a safety concern centered around being able to see their surroundings at night, as well as being seen by other drivers while biking at night. This concern increased during harsh weather conditions such as snow, rain, and ice. Student participants indicated that their main challenge was sharing the road. This was expressed as a safety concern as well, and it centered around biking alongside drivers who were unaware or not paying attention to them and their concern for being hit while biking. This concern also increased while biking in harsh weather conditions. Next up is walking challenges. So participants that do not use walking as their primary mode of transportation indicated that the main challenge was time. Faculty and staff specifically indicated that their time challenges were related to proximity to campus and inconvenience. Most faculty and staff participants mentioned that it was not convenient to walk to and from campus. Due to their responsibilities outside of work, faculty and staff would much rather bike than to and from campus. Students specifically indicated that their time challenges were related to proximity to campus and weather. Okay. Lastly, we have alternative transportation safety issues and precautions. Faculty, staff, and student participants also mentioned having encountered an injury. The students specifically mentioned having an injury that occurred while biking. Of the participants that indicated experiencing a near miss while walking, most indicated that it had been with either drivers, automobile traffic, bicyclists, or e-scooter riders. Participants specified that near misses involving drivers, automobile traffic, and bicyclists happen because there was a lack of awareness from the driver or bicyclists because these modes did not allow for pedestrians to safely walk through crosswalks. E-scooter related near misses happen due to e-scooters being ridden on sidewalks instead of on the street or bike lanes, and riders were often discarding their scooters on the sidewalk in a way that made walking more difficult or created a hazard, especially for those that require mobility aids or ADA accommodations. The primary safety precautions taken by participants who biked were wearing a helmet and or wearing visibility gear while biking. Participants who walked indicated their main safety precautions were having awareness while walking and utilizing crosswalks or sidewalks. Students specifically mentioned having awareness in areas around campus that lack visibility due to little or no outdoor lighting, with some opting not to walk at night at all. Moving on to our conclusions, the findings revealed that faculty, staff members, and students not only use alternative transportation, but having multiple transportation options is essential. Also, safety issues and precautions must be addressed in order to advocate for increased use of alternative transportation. This formative evaluation should be replicated and include unconventional methods like skateboarding or electric scooters to further assess their usage among faculty, staff, and students. Education concerning alternative transportation options should be provided widely and emphasized to the university community members to create a more sustainable, focused campus. Using the information from Texas Transportation Institute's injury data and the results from our formative evaluation, an educational component was developed by Domenique, who will talk about that a little further. Thank you.
Hi, everyone. My name is Domenique, and my role in this project was to develop and pilot a health education program to increase safe alternative transportation use in and around the Virginia Tech campus. This education module connects the first two components that you learned about today. It was informed by the themes that emerged from focus groups and in its final iteration, it will incorporate information from our TTI team members. In addition to focus group themes, the development of this education program was also grounded in health behavior theory. Today, I will discuss how health behavior theory was used to develop the education modules and go over the evaluation results of our pilot test. The design of this health education program was guided by health behavior theories. Health behavior theories are used as a framework to understand motivations and readiness for behavior change. The alternative transportation education program utilized the trans-theoretical model, seen here, and the health belief model, seen here. The trans-theoretical model proposes that behavior change is a dynamic 5-stage process, designing around the stages of change that best match focus group participants. We honed in on the preparation and active stages of change. In the preparation stage, individuals are planning to take action and are making initial steps towards using alternative transportation. In the active stage, individuals have recently begun to make changes to their behavior and are in need of strategies to sustain the behavior. Therefore, we provided education to equip those in the preparation stage with the resources and skills they need to successfully try alternative transportation, and those in the active stage with strategies and resources to support their new behavior change. Furthermore, this model asserts that progression to behavior change is facilitated by 10 processes of change, as well as a decisional balance of weighing the pros and cons of changing behavior. Similar to this idea, we incorporated additional concepts from the health belief model that proposes that the perceived benefits of engaging with the behavior must outweigh the perceived barriers. To conceptualize these ideas and apply them to alternative transportation, we incorporated what focus group participants identified as the barriers and facilitators to using alternative transportation at Virginia Tech. Taking into consideration the theories of focus group findings, a 5-part educational program was developed that connected concepts to university resources. This resulted in a 5-part educational module that included information on public transportation, active transportation, the health benefits of alternative transportation, the connection between the environment and transportation, and safety. Each unit had a pre and post knowledge test, as well as an activity to allow the educational content be applied to their own lives and their own transportation choices. So here you can see a sample of how the educational content connected with health behavior theories and focus group results. The orange bars represent our focus group findings, and the squares at the bottom represent the various theory constructs that define the trans-theoretical model and health belief model. Focus groups allowed us to understand what individuals in the preparation and active stage perceive as benefits and barriers to using alternative transportation. So understanding these benefits and barriers was key to understanding what education was needed to sway the decisional balance towards using alternative transportation, and how to counter negative thoughts associated with the challenges of using alternative transportation. These themes were then applied to the resources available at Virginia Tech, paying particular attention to highlighting the resources available in the community that encourage alternative transportation use and offering solutions to the challenges that discourage use. While this is not a complete list, focus group findings inform the inclusion of the following topics in response to the challenges that were shared. We included how to share paths from the perspective of multiple users, how to safely navigate sidewalks, roads, and intersections from the perspective of a biker, how to find ADA accessible options, how to improve visibility in poor light conditions, how to combine multiple transportation options to create backup options, how to find safe routes, and information on campus showers for commuters, which addresses the need to look professional as well as the challenges related to weather. As Sam mentioned, biking and walking were identified as a top choice or a backup choice for alternative transportation use by our focus group participants. Using this input, we highlighted biking resources and the health benefits of walking on campus. Earlier, TTI shared a tool that presents exposure measures, such as trip counts, trip duration, and trip distance for all our states and the metropolitan planning organizations. This tool is in line with our focus group findings that biking and walking are modes of alternative transportation used in the Virginia Tech area. In the Blacksburg, Christiansburg, Montgomery area MPO that Virginia Tech is captured in, annual walking and biking also show a slow rising trend. Each of the units also use the trans-theoretical model to guide how educational material is presented to students. Here, the red bars represent the resources, skills, and education that support our theory constructs. In the next slide, I'll provide an example of how each education unit incorporates theory constructs into the presentation and framing of the skills and resources. In the public transportation unit, students were required to learn how to plan their trip using our local public transportation mobile app or website. This activity not only helped build skills, it also served as a way to change their immediate environment and create a cue to use alternative transportation, which meets the construct of stimulus control. In the active transportation unit, the Hokie Bike Hub, our free on-campus bike shop, was heavily featured to connect students with individuals who could support their alternative transportation goals, which addresses the construct of helping relationships. In the health benefits unit, student testimonials, where VT students and faculty shared how using alternative transportation has personally improved their physical and mental health, served to provide dramatic relief or the emotional reaction needed to push behavior change forward. A unit on the effects of single occupancy vehicle use on the environment aided in pushing students to consider the effects of their actions on others, addressing the need for an individual to consider environmental reevaluation. This unit concluded with an activity where individuals calculated their own transportation carbon footprint, meeting the need for self-evaluation, where they could reflect on their contribution to carbon emissions. In the safety unit, the construct of social liberation was applied. A safety video featuring our beloved mascot, the Hokie bird, and the VT Spirit Squad was created to communicate that using alternative transportation and using it safely is an accepted social norm here at Virginia Tech. Throughout the safety unit, safety data was incorporated as a way to increase awareness of the problem and help students understand that they are at risk or they're putting others at risk if they take part in unsafe transportation behaviors, which also addresses the constructs of raising consciousness and environmental reevaluation. We were able to pilot this educational module with 38 Virginia Tech students in a master's level public health, health behavior, and health education course. We sought to understand if the program produced a change in knowledge and behavior, as well as understanding the student experience. To evaluate if a change in knowledge occurred, students completed a pre and post test for each unit. We found a statistically significant increase in knowledge across all units. Students also completed a transportation behavior self-assessment before and after the course to evaluate if a behavior change occurred. Based on the results, there was not a statistically significant increase in alternative transportation use. It's important to note that while the educational module was designed around our focus group data and the stages of preparation and action, the pilot group who tested the module primarily reported beginning in the stage of pre-contemplation. In addition, the trans-theoretical model defines behavior stages in 6-month increments. Taking this into consideration, future testing should recruit individuals who are in the preparation active stage and allow for 6 months between the pre and post test to align with the definitions of behavior change that the trans-theoretical model uses. In addition, student feedback was gathered through focus groups and surveys, and overall they had a positive experience. We learned that they felt the time required to complete the course was appropriate and manageable. They did not have difficulty learning the platform. They felt that the knowledge tests aligned with the content provided and enjoyed how the presentations and content was delivered. They also felt that the activities reinforced learning, but did prefer an interactive or skill-based activity. Based on this finding, future iterations should partner with on-campus opportunities to build activities that allow students to interact with our transportation resources. Overall, the evaluation of our education module supports that a program focused on promoting alternative transportation use can be accepted by university students. Thank you all for your time and attention today, and I will welcome Laurel back for our Q&A.
Thank you so much, Dominique. All right, so right now I did notice that some people had their hands up and we are having a little bit of technical difficulty here. So the chat boxes, again, we're using the question and answer box that's underneath there. So if you have any questions or if you want to talk, that is also fine. You just need to raise your hand and I will just get your microphone open so that you can talk. Or if you want to put a question in the question and answer box, we can get to them that way. Let's see what else I'm saying. Two actually questions, Dominique, since you just finished, I'll put you back on the spotlight. First off, what do you think that the students found the most enjoyable in that course? And then also, where do you see this course being valuable for the community? Like, how do you see it being used or integrated into the community by?
So when we did our focus groups and surveys, we learned that they really enjoyed the plan your own route activity using our public transit app. A lot of students have been curious about how to use it or how to use our public transportation system and have been relying on roommates and friends to help them use the system. And it was something that they could learn and go out and use the next day.
Becoming more independent for themselves.
Yes, and
okay.
They could travel, to campus and around town. I think this module would be really important to our community here at Virginia Tech because we have a lot of resources and it is difficult to learn them through word of mouth. And this would just be a centralized way to, as you're introduced to the university, you're also introduced to alternative transportation options and you can incorporate it into your daily life from year one.
So maybe like an orientation
yes.
of the university and like what's awesome. That. And also failed to mention, but we also have Nick Quint here, who is the Transportation Network Manager and here at Virginia Tech and works in the Alternative Transportation Department as well. So he's also here, should there be any questions for him. Nishita, I have a question for you. Why do you think that it is important to really look at different measures of exposure when you're calculating injury rates in particular?
Yeah, thanks, Laurel. I think, as I was discussing earlier in the presentation, all different exposure measures have certain limitations, especially trip counts, because it is less likely to factor into the speed at which people walk or the distance that they cover in each trip. So it might not give us the kind of exposure to risk that we would like to incorporate in our rate estimates. So it's important that we look at trip duration, which allows us to factor into speed of people who walk slower than others who walk faster. And also because trip durations are easier for people to remember than trip distance. Yeah.
Do you see, just when you looked at all the data that was available, did you find like, okay, this is something that really needs to start being collected or could easily be collected, or would be very difficult to collect to try and get these estimates on injury rates cleaner?
Yeah, I mean, as far as the numerator data go, we at TTI and with the Texas Department of Transportation, we talk a lot about how an integrated data source system would be so helpful, because if we had the hospital data linked with crash data, that would allow us to look at all these measures at once without losing some of these cases that we do when we probabilistically link these data sets. And we are working towards it. We recently have a project funded that would help us move forward in that regard. So that's something that would really help us get a good handle on what's the injury rate and the count that involves both motorized and non-motorized events, along with hospital data records that are always helpful.
Okay, thank you. I do want to let everyone know as well, this webinar is being recorded, and both the video of the webinar as well as all of the slides which you saw today, which I know there were a lot of slides that had a lot of information on it, so you probably want to go back and take a clearer look of that, are available. Well, they will be available within a week. And if you registered for this webinar, you will receive an email when they are available. They're available on the project website, where the final report will also be given. So I was sending everyone who's here right now a link out to the video, as well as the slides, and also where you'll be able to get that final report, which will hopefully be within the next month. I also just dropped a link in the chat box. That is a registration link for our next webinar, which is now open. It is going to be on learning active inference models of perception and control. It's going to be presented by Texas Transportation Institute. And it is scheduled for September 20th at 2 o'clock Eastern Standard Time. You can register now with the link that's in the chat box. Or if you're registered or you're signed up to get our emails, you'll be getting that as well. The link will also give you more information about that webinar as well. I'm going to leave this open just for a little bit in case anyone has any more questions. But otherwise, I would like to thank you very much. Thank you all the panelists for sharing all your research, and thank you for attending, and hopefully we'll see you in September. Thank you.